So we're seeing that in every area of social life where racial inequality has existed, the coronavirus is shining a light on those inequities. So we just start with the healthcare system, not only in terms of who has access to it. You know, the US has a very inequitable healthcare system. And so in terms of who has insurance that covers procedures, we see lots of inequality that's affected by racial disparities. But even if we move beyond healthcare, if we look at employment, the kinds of work that people do, you know, for racialized populations, we are often working in low-paying but essential work that continues now through the virus, that doesn't have sick paid leave, in which people know that they will lose their jobs if they're feeling sick and they stay home. So that's shining a light on that. If we look at our jails and prisons, where many people are in very overcrowded conditions where the virus is likely to spread, many people, the vast majority of people in our jails have not been charged of a crime, for example, and yet they are in some ways given a life sentence because now they're exposed to the virus. Even if we look at education, we know that now that schools are online, there are many students who can't access the internet, right? Even to access their teachers and to continue with school. So that's been disrupted. And even when we think about people who want to act in solidarity with their communities and their society and wear masks as they go grocery shopping or go out in public, and homemade masks, as a Black person, you may be seen as a threat if you have a mask on. And so many people are wary about even wearing a mask, even though they want to do that to protect those who they're around. And so there's almost no area of our lives in which pre-existing racial inequality are now being exacerbated due to the coronavirus. Absolutely. You know, in the first few weeks of people actually paying attention to the virus, there was a kind of a mantra that we're all in this together, that even a public health posters and slogans that would say, the virus doesn't discriminate and neither should we. And so in part, we would hope that is the case, because many people many Asian Americans in the United States were being physically attacked and harassed because they were associated with the so-called Chinese virus, a phrase that itself is a racist kind of phrase. And so we would hope that something that can affect us all would actually unify us, right? A shared biological fate. But in fact, what we are seeing is that in terms of who is infected and who is dying at larger numbers, poor and racialized people are more vulnerable. Not only are they more vulnerable, but their conditions and their vulnerability is being itself used as a way to stigmatize them and make it seem as though they are causing the problem that they're affected by. And so when we say that the virus is a biopolitical reality, we're saying that the political contours of our life are actually shaping who is affected, who is treated, who is cared about, and how urgent this seems. And so we have to think about how inequality is shaping this, the spread and the perceptions of this illness, as much as we are looking for a cure to the illness itself. It's possible, in the same way that we see discriminatory algorithms in other areas before the virus. It's likely that if we're not thinking carefully about how assumptions and values are shaping the design of these systems, they will reproduce the existing hierarchies and forms of stratification. As just one example, many hospitals have protocols in place that formally say they shouldn't discriminate against people based on their race, their age, their disability, their ability to pay even. But in allocating ventilators that are in short supply in the United States, in many states, they have a set of guidelines that are being encoded into algorithms that say that you should give the ventilator to the person who is more likely to survive. That is, someone who is healthier and fitter should get the ventilator versus someone who comes in with comorbidities, pre-existing conditions. And so we have to ask, who tends to be healthier and fitter and why? And oftentimes those categories are euphemisms or code words for forms of inequality based on one's class status or one's racial status. And so if you're allocating scarce resources based on someone's likelihood to survive, then what you're saying is that the people who've been likely to survive, who've had the luxury of being healthier in the past, often due to forms of stratification, then they are going to be privileged over other people. And these kinds of assumptions that are valuing human life, right? We can even think of them as eugenic in the way that they're privileging some lives over others, are right now contouring who is getting these resources. But the important thing to understand is that it's not just, shouldn't be our goal simply to make fairer digital triaging systems, a fairer way to allocate these resources. Instead, we really have to understand that scarcity is a myth. Scarcity is manufactured. The fact that we don't have enough ventilators or enough resources to give to everyone, that is not inevitable, but it's an outcome of human decisions. It's about prioritizing, it's about not prioritizing the common good, right? Through a series of past decisions in terms of the way that we structure our healthcare system. And so rather than just trying to tweak the algorithm and make it more fair so that more people have access to these ventilators, let's think about how to address the underlying scarcity so that we can redistribute resources and everyone's lives are valued. So even here, there are apps being proposed for contact tracing, for keeping track of infections and so on. And we have to understand that these technological fixes don't exist in a vacuum. That is to say that communities and populations that have been hyper-policed in the past, that have been racially profiled in the past, these technologies may simply exacerbate that. We know, for example, in the UK that the first person to be arrested under the Coronavirus Act there was a Black woman. Now the authorities admit that that was a bogus charge, but she was profiled and punished under this seemingly colorblind policy, the Coronavirus Act. And so even though a technology may on the surface seem like it's neutral, everyone is going to have it, everyone is going to download it, the way that it's implemented, even the various models that actually shape the design of these apps and these algorithms are likely to harm already vulnerable communities. And so if that's not prioritized in the design and the implementation of these technologies for contact tracing and so on, then we're going to see technology exacerbate forms of inequality and harm that may not even be the intention, but that will be the effect. That's a very, very hard question. And I thought, oh my goodness, have I even been aware of anything that's not in some way connected? And so I'm going to cheat a little bit on my answer and say that it's still corona related. But I would say one of the challenges we face is not to have our attention solely taken up by what's happening in the US and in Europe. And so partly we can learn important lessons if we move beyond the US and Europe and see what's happening in other places. And I'll just offer two very brief lessons that we can see in other countries. The first is Singapore, which is interesting because early on, Singapore was being lauded as a place that was able to contain the virus. Between January and March, it only had about 500 cases, but in the last month, they've had now 11,000 cases. And one of the lessons we're learning is that the reason for that explosion of cases is because of the government's neglect of migrant workers who live on the outskirts of the island, who are clustered in very cramped dorms, whose employers don't give them sick leave. And so by ignoring these marginalized communities, the entire country is now made vulnerable. And so that's a lesson for people across the globe, countries across the globe, that we have to look at the people who are most vulnerable in order to help everyone. And secondly, another country on the other side of the spectrum is Senegal. So oftentimes we look at African countries as only needing resources. But in this case, there's a wealth of knowledge and expertise there that we can learn from elsewhere. With not fancy labs, they're able to provide universal testing in Senegal by producing very cheap testing kits. And then by making it universal, they're able to have a much clearer sense of who is affected. They've also been able to 3D print ventilators because they don't have access to the fancy ventilators, and they're willing to share these resources with other African countries. And so there we have a sense of resourcefulness and a sense of shared responsibility for the common good that's making Senegal an example for other countries to follow. And so I would encourage us to look beyond the US and Europe and see both the lessons, the pitfalls, but also the great examples we have in African countries for us to learn from.